Hello, it's me again. My name is Kim. For anybody who's watching this, I apparently am going to make these videos when I'm driving home just because I don't have interruptions or people listening to what I'm doing at home, so it just provides me a little bit of quote-unquote uninterrupted time to just talk about what's going on with me and my body. So I kind of left off talking about me gathering up all my health records after I found Dr. Feigenbaum on the Tarlov Cyst Institute's or Foundation's website. I basically, after I went to the doctor who called for my MRI and actually said, you have, Tarlov cysts. I think this is what the cause of your problem is. He basically, in lesser words, slapped me on the butt and said, good luck. There's not much we can do. Surgery is too risky. After I got that kind of diagnosis, I cried. I was so sad that I didn't have opportunity and hope. So I did some research. I went on Facebook. I found a support group, which I highly recommend anybody do if they are looking, for support and help. That was really nice. A positive support group, I should say, because there's some out there that aren't as positive. But I found a good group of people who also have this rare disease. Those who've gone on this journey long before me. Some who've had surgery, some who haven't. Some who, are currently making the decision, and every day new people who are joining the group to learn how to either to support their caregivers and loved ones or people who have themselves been diagnosed. This disease often has other underlying issues involved as well, like Ehlers-Danlos syndrome, also known as EDS. So it was nice to get that group. I quickly got connected and found Dr. Feigenbaum. There's two guys in the U.S. that do these surgeries, and Dr. Feigenbaum's practice is solely devoted to doing this. I finally felt a little bit of hope that there is potential for someone who at least believes that these exist. I was really lucky in that I found someone who believed that the cyst could be the cause because we ruled everything else out. But a lot of people don't have that journey in their lives. And so I'm really lucky that I did find someone who could help. So I got all my MRIs together. I filled out the paperwork. I'm very grateful that Dr. Feigenbaum's office lets you do phone consults, because I didn't want to go there in person just yet to find out that, it's not Tarlov cysts, and, travel to Texas and all of that. So I sent my records over to him in November of 2018. It was around Thanksgiving, and then I waited. I started really digging even deeper into what I could find, asking a lot of questions of people in the support group. I'm not sure if I mentioned this in my last video, but I have Tarlov cysts in my cervical spine, so in my neck. Most people who have these Tarlov cysts have the cysts in their lower, sacrum, tailbone region, or in their lower back, and I am a weirdo unicorn who has them, symptomatic ones in my neck. And so because it's already a rare disease and it's not researched a lot, and modern medicine basically says that these cysts don't cause problems, they're asymptomatic, there's not a ton of research already to start off with about the cysts, but it doesn't, it goes even into less information, even on the Tarlov Cyst Institute's page, saying, when they talk about all the symptoms, they tend to reference the lower back more than anything else. And so, as I'm going through this journey, I wanted to make sure to capture the experiences I've had having them in my neck, because there's even fewer people that have experienced that. So I met a life light. In case you're wondering, I'm not driving without my hands. So I sent my records in, finally got a call from a nurse, and scheduled a time to talk to Dr. Fagenbaum. This was in February, that I had a chance to talk with him. I was expecting a call probably around like 3 o'clock, and lo and behold, he was calling me significantly earlier than that. I neglected to remember he's in Texas, so our times were off, but either way, I was able to chat with him very quickly. He confirmed that the cysts I do have are Tarlov cysts. They seem to be symptomatic. I was so desperately hoping in that phone call he was going to say, yeah, surgery is an option for you, let's go. But that wasn't in the cards for me. He quickly said, because I have bilateral perineural cysts, which means, the nerve endings come out of either side of my spine, and on each of the 3 vertebrae levels, I have a cyst on either side of my neck, at each of those layers. He said, without knowing which one's causing your symptoms, I can't recommend surgery, so he recommended I get a diagnostic nerve block. And with diagnostic nerve blocks, there is they're typically used for therapeutic reasons. So you get a nerve block, they put, they give you a local anesthetic, and then they put in, steroids to lessen the pain for a long period of time. Dr. Fagenbaum, because of these cysts, doesn't want you to not have pain, as he's trying to diagnose which nerve is the one causing the pain. And so I set off to go get my diagnostic nerve block because I really do want answers. That posed more of an issue than I thought it would. He said, reach out to your primary care, or go to your pain management person, and they'll get you a nerve block. And so I don't have a pain management specialist. I have dealt with this pain through Advil. When I met with the first doctor who actually diagnosed or suggested that the cysts I had were in fact Tarlov cysts, he gave me a muscle relaxer and an anti-inflammatory pill. I rarely take them unless I have really, really bad days. I have learned how to manage my symptoms. So I lay down on the weekends a lot. Posture helps, things like that. Pulling my shoulders back, reducing my stress. I usually live around a 3 to 5 daily in pain, going up to 10 being the highest, and then on bad days or days I overexert myself, I get up to an 8, 9, or 10. And so I tried to find a person who could help me get this diagnostic nerve block. That proved really difficult here. I live about 3 hours away from Portland in a smaller town, and we tried to I went to my primary care. She said, oh, well, you should go back to the place that you originally got diagnosed from because they have that there. I reached out to them. They said, no, we don't do that. Specifically, that they don't do it without the steroids piece. Every doctor I started talking to started really making me panic because I would tell them the situation, and each one of them was like, oh God, I wouldn't do that surgery. Like literal medical professionals going and saying, I wouldn't do that. I wouldn't do that. You can take drugs, take this or take that. And right now we're in a big old opioid epidemic, and I really don't want, if I can avoid putting that stuff in my system, I'm going to. That's just a personal thing for me. I'm not judging others who do, because I believe that pain is real. I believe that my pain, I've learned how to manage and navigate around it so that I don't have to take pills. My mobility is limited at times. I can't work out and put my hands over my head where my elbow goes over my shoulder. That tends to be an issue. Lifting really, really heavy stuff over my head tends to be an issue, but I can still manage my day-to-day. Sitting for long periods of time really sucks, but I get through it. And so, and I have a really high pain tolerance to begin with. So every doctor I was talking to kept saying, oh, I wouldn't do that. Oh, that seems really risky. I wouldn't do that. And that's part of, I think, the journey that people who have rare diseases go through, is their disease hasn't been researched, isn't common knowledge, and it freaks people out. So I, again, was feverishly trying to find someone who would do this nerve block for me, because I'm not even asking them to do surgery. I'm just asking them to do a simple procedure so I can know which nerve is causing the pain. And basically what they do is they inject a local anesthetic into your, for me, my neck, around that nerve, so it kind of coats that nerve, and for 2 hours you don't feel pain if that's the nerve that's causing the issues. And so I made sure before I went into that surgical procedure to do all the things that agitate my shoulders. So I went in at about a level 3 of pain, and afterwards I walked out of there not having pain, and then about 2 hours later, my numbness in my arm and the tingling in my arm started coming back, and then I knew that we knew that my C7 on my left side nerve is the one that's causing the pain. I proceeded to, I should pause here and say, that procedure freaked me out. I don't do needles. I hate needles, let alone being awake and having one jammed into my neck. Freaked me out. I mean, I cry if I have to get an IV drip, for that matter. So I was already on high alert. I was exhausted the day of that procedure. I was just drained from having to go through that. It took a lot out of me, but it was totally worth it. Told my doctor who did that procedure, he came highly recommended, and that was important for me because his name is Dr. Andrews. That was really important for me because for as many doctors that went, oh, I wouldn't do that, I went to him, met with him right before the surgery, and he basically said, oh, I do this all the time. It's like 50-50, no big deal. So I really do think that finding the right doctors, advocating for people, and finding the people who do feel confident and that do this regularly, and not letting other people scare you out of the decisions to move forward just because they're scared and they're not knowledgeable about it. It's really important. And so I proceeded, I'm going to take you guys to my mailbox because that's what I do when I drive home, is I check the mail. So you get to go on a little journey with me.